the executive director of both Washington Filmworks and WhipSmart. For those of you that haven't heard of WhipSmart yet, it is our new partner organization, which is a trade association to support creative workers and creative businesses. Thanks for being here today for our next installment of the safety on set conversations we've been having. We're very excited to have with us today Dr. Frederick, and I will introduce him in a minute. Before jumping into the conversation with Dr. Frederick, I wanted to take just a few minutes to talk to you about the resources that Washington Filmworks has published on our website to help the film industry go back to work safely. For those of you that have tuned into this safety on set conversation once or twice before, the information I'm about to go over will sound very familiar to you. So if you want to grab a cup of coffee or go get a glass of water, now would be a great time to do so if you don't want to hear it again. But with that being said, we have, with a task force from around the state of Washington, put together the safety protocols that were approved by the governor on July 8th that the governor approved so that we can go back to work. The name of the document that was approved is called the Phase 2 Motion Picture Production COVID-19 Requirements. This document is an overview of the mandatory safety protocols that were approved by the governor that all productions must follow, regardless of the size of their budget, whether you are shooting on public or private property, or if you're a union or non-union shoot. So it's a very short document. It's about 3 pages, and you'll see in this document lots of things that we are following within our communities right now. So, remain 6 foot apart if possible. Wear masks and things like that. But there are things that are unique to the film industry. For example, every set must have a COVID-19 safety plan in place. And in addition, every set must have a COVID-19 supervisor. This person is charged with enforcing the safety plan and monitoring the health of workers on set. So that document is on our website. But in addition, the task force that we worked with put together a second document called the Washington State Motion Picture Production COVID-19 Best Practices document. In this document, you're going to find a lot more detail. So there's industry standard best practices that we borrowed from some of our union partners and some of the things that they put forward. We also read over 50 standards from around the world, from different film communities around the world. And we took some of the best practices from all of those documents and put it in one place for you. Also in this document, you're going to find department-specific recommendations for each department. So we've heard that has been very helpful. And then we also give links to documents that you've probably heard a lot about, things like the Safe Way Forward, which is what the national unions put forward as some of the best practices for the industry. In addition to that, and to those documents, the mandatory safety protocols and the best practices document, we have gathered on our website a ton of different resources. Things like how to access PPE, which is a requirement on every set. We have created a section on the website with a lot of downloadable resources for producers. A couple things that we think and have heard are very helpful to the community has been something called our COVID-19 set safety checklist. So what we did at Washington Filmworks is we looked at those mandatory guidelines from the governor's office and we created a checklist. And if you can check all the boxes off on our checklist, then you know that you're following the mandatory safety protocols. In addition, we created something called the Basics for Crew. You can send this document out. It's a 2-pager about all the basic stuff you need to know as you walk onto a set. And you can send that out with your start paperwork, perhaps with the daily call sheet. And one other thing that I will just mention in this conversation that we've gotten a lot of great feedback about is the business signage kit. So you are required to post up on your sets different signage about, about COVID. And so you can download all of those things there on our website. If you go to our website, which is washingtonfilmworks.org, we have a page there called the COVID-19 Production Resource page. So take a look at that there. If you have specific questions about, either the industry best practices or the mandatory guidelines, go ahead and drop them in the chat on the YouTube site, and we'll try and get to them at the end of the conversation if we have time. So, great. So let's move on to today's safety on set conversation. Now that the film industry has been back to work for over a month now, and actually implementing these safety protocols, we've gotten lots of questions that we're just not qualified to answer. Things like, how does the virus spread? What does it mean to quarantine? What's the best mask to use to keep our set safe? So to help answer these questions, we've invited Dr. Matt Frederick, an emergency medicine doctor from Swedish hospital, to come answer some of your more urgent questions. So Matt, if you want to join the conversation, that'd be great. Great. Well, good morning. Thanks for joining us today.
My pleasure.
Of course, thank you also for, and the team at Swedish for doing all that you're doing right now for our communities, of course. So, but I'd love to, just start the conversation by having you introduce yourself and who you are and give us a little bit of background about you.
Yeah, so I'm an ER doctor, primarily at Swedish Issaquah on the east side. So we were very close to kind of the beginning of this whole thing at Life Care in Kirkland. So we had the misfortune, I suppose, of being, one of the first kind of hospitals to see this thing. But we've learned a lot, and I think learned really quickly about it. I went to medical school in Texas and then did residency in emergency medicine at Wake Forest, and have also spent some time teaching at Duke and University of Tennessee.
Mm-hmm. Not a dull moment for you.
This has been a busy 10 years. Yeah.
It's been a busy 10 years, and joining us on your day off. So thank you for that too. So
no problem.
So I do want to jump into the film specific stuff, but I really would love to start, Dr. Frederick, with you giving us kind of the 2-minute overview of what is the breaking news about the virus that we should know, or what have you learned more recently that you think the community needs to know?
I think, frankly, a lot of the science is pretty clear at this point. We're still learning a lot about asymptomatic spread. So I think that's still a question. We're still learning a lot about why certain people get sicker than others. Those are probably things that we won't be able to sort out until we have enough data collected over a period of a year or whatever to really make some good estimates about why these things are happening. I think the thing that we're learning the most about right now is probably just human nature and how we manage populations in the face of things like quarantine and isolation, because that truly is I think the biggest battle we're fighting. I mean, we could stop the virus, we could eliminate COVID-19 in 2 weeks, right, from the whole world. It wouldn't be that hard. Just nobody can be around anybody. And so that's the thing that I think we're constantly the sands are shifting, because we've never tried in our modern society to isolate people the way we're doing right now. And it's impossible. And so we're constantly sort of trying to adjust what's safe and what's reasonable.
Mm-hmm. And it's that balance, right? The mental health is versus, protecting us from the virus.
Right.
Yeah.
Right.
To that end, and as we go back to set, one of the questions has been what is the most common way someone can spread the virus, and what are the facts around that?
So by far the most common way is respiratory droplet, and more specifically, people coughing near you is going to be by far the most common way this happens. Also, people speaking can do it. As you speak, you produce sort of respiratory droplets, saliva coming out. Those are really by far the main ways that it's going to happen. There's some risk involved with maybe touching something that has the virus on it and then touching your mouth after. That's things like eating and drinking in high risk areas are going to be potentially dangerous behaviors in that regard. But we think probably the vast majority is a respiratory contamination, just like you would think of with a cold or the flu or something like that.
When you say eating or drinking in a high risk area, what is that a high risk area from your perspective?
Places where there's a lot of people gathered. For us, obviously it's a little bit different, but like we don't eat at our workstations. We try, even when we're in break rooms, to eat separate from each other because those are times that obviously, first of all, people are taking off their masks. Secondly, there's more respiratory pathogens being produced because you're smacking and you're chewing and all those sorts of things. And third, that's a time that obviously your hands are going to your mouth.
Got it. Great. So I think that you know this already, but every set is now required to have something called a COVID-19 site supervisor. And that person's job is to enforce the safety plan and monitor the health of workers on set. I guess our basic question is, what are those symptoms that should be the red flag for anyone working on a set that are an indication of the virus?
Yeah. I think, so I would start off by saying that if you're sick, in the way we operate as a society today, there's at least moderate chance that it's COVID-19. There's just not that many communicable diseases going around because of the social distancing practice that we're doing and wearing masks. So any sort of symptoms of infectious disease, you should probably think really hard about, this might be COVID-19. That said, more specifically, the things that we're sort of honing in on: fever, cough, sore throat, and malaise and body aches are kind of the most cardinal symptoms. And then some of the less common but certainly notable symptoms are the loss of taste and smell, which is definitely a real thing that people have seen, and less commonly GI problems like diarrhea.
Mm-hmm. What is the purple toe thing?
Yeah, so COVID causes clotting of the blood, and you can get little microemboli, so little tiny small blood clots to the most peripheral circulation.
Got it. I can tell you this is the most different conversation that I've ever had in my 13 years of being the film commissioner. I just it's very unique for me. So never a dull moment in
pretty unusual, yeah.
So our most of the bigger projects that come through Washington State are union projects, and our union partners are negotiating their production deals right now, and they're talking about testing, and they are, the intention is to require a certain amount of testing, during a production. So if you're closest to camera, for example, you would then be tested up to 3 times in a 5-day week, as an example. So, we just wanted to chat with you about your perspective on the state of testing in Washington State and the availability specifically of rapid testing.
Yeah, testing is a pretty crazy deal, obviously. It's like all over the place. As far as rapid testing goes, it is probably helpful as a screening tool. So if you're taking a large group of people and you're trying to figure out, how many of these people are kind of safe, none of them have symptoms, it has some value there. But it is, so far, the rapid tests that have been developed are not highly sensitive. So there's a pretty big concern about things like false negatives. So like, for example, some hospitals are deploying them and some are refusing to use them because they don't feel like they're consistent enough to make good decisions based upon. And then, so those are the sort of like the tests that come back in minutes, the very rapid tests. And then they have some analyzers that are being able to run tests on a limited basis in about an hour. And those are good. Those are reliable tests. But there's some limitations as far as the amount of those tests that can be done at a time. So for example, I think Evergreen Hospital or something has a rapid analyzer, but I think they can do 20 a day or something like that. So there's limitation in the actual chemicals that run the test, which is controlled by the federal government. So there's some difficulties with that. There is likely on the horizon a saliva test as opposed to the swab that goes in your nose. And that one has been used by the NBA, actually has been the pilot group for that. And
in the bubble.
Yes, in the bubble. Yeah.
Yeah.
Yeah. And that one is probably, if that gets pushed out, will probably be the most reliable rapid test. And hopefully that'll be, in the next couple of months, we'll have that.
So I want to ask a couple follow-up questions there, and I might be remembering incorrectly, but is it true that the FDA hasn't approved all the testing, the rapid tests? Is that true? Okay. Is
Yes.
there a more reliable version of rapid tests versus other tests that is, having less false positives?
Yeah, there's differences based on every brand. And you can kind of look those up when you buy the specific test. But even those numbers are probably a little suspect because the reason the FDA hasn't approved them is, one, the numbers aren't as good as they feel like we should be using for a potentially critical illness. And two, the data that those numbers are based upon is limited. So I think, to some extent, like you're rolling the dice a little bit on any of those rapid tests that aren't FDA approved at this point.
Got it. So shifting away from rapid tests and into the tests that most people are taking right now, is testing readily available in Washington State from your perspective?
Yeah, I think it's pretty easy to get a test. Most urgent cares do it. All the ERs do it. A lot of family practice docs do it. So it's not too hard to get a test. The results might take 12 to 36 hours to come back. So.
Right. So that's really, it's not the availability of tests anymore. It's the turnaround time for our particular industry. That's what, I think I'm understanding from the conversation. Yeah.
Yeah.
One of the questions that has come up, and they asked the film commissioner, I was like, I got to ask Dr. Frederick, is how long does it take for a test to recognize that you're sick? Like, do you have to have the virus in your body for days, or is it pretty soon after you contract it that it shows up on the test?
Well, so I guess that's currently a unanswerable question with 100% accuracy, because the same tests that we're using to answer that question are the same tests that people are using to answer whether or not they have COVID-19, right? So it's not like there's one batch of more sensitive tests that we're testing against the ones we're using right now. We only know when we know. So the thought, based on just kind of when people are exposed to when they turn positive, is that we're thinking probably about 2 days. Okay. But we don't know if there's a period of time that we're missing and our tests just aren't sensitive enough to pick it up yet.
And do you know, I had heard that we had approved pool testing. Is that the right phrase? Is that happening in Washington State?
It's not to my knowledge.
Okay. So my takeaway is testing is readily available. The turnaround time is, a little bit longer. Rapid testing, not so reliable right now, and maybe a little bit harder to get in terms of availability.
Yes.
I want to jump into the next topic, which is asymptomatic people. And can you So there's lots of people who are asymptomatic, is our understanding. And they spread the virus? I guess we should just start there.
Presumptively, yes. Yeah. I mean, how asymptomatic are some of these cases where people have spread it? Like, did they have any symptoms at all? It's hard to say, but there's definitely plenty of cases where it appears that there's been asymptomatic spread. So I think we're assuming the answer is yes.
Mm-hmm. And so those people who are asymptomatic are most likely not being tested because they don't have symptoms, right?
Right.
Is there anything else I should be asking about that? I mean, so conceivably, if you're on a film set, you could have asymptomatic people spreading the virus without knowledge, without presenting any of the, typical symptoms you talked about earlier. And so it's really challenging at that point.
It is, yeah. And I mean, I think that's, at least a big part of the reason we haven't been able to win controlling this thing. Because, so if you took 100 people and you tested them, 50% of the people that came back positive at any one time would probably be asymptomatic. Mm-hmm. And of that 50%, only half of those people would even ever show symptoms. Mm-hmm. At least that's sort of our guess right now, based on like the Princess cruise ships where they're doing testing of every single person. Mm-hmm. So that means that 25% of people may not ever show a symptom of this. But the fact that we can detect viral DNA in their nose when we do a test probably means that they're capable of spreading it. Mm-hmm. You hope not to the same degree as a symptomatic person, perhaps because they're not coughing, maybe their viral load is lower. But unfortunately, they're contagious in some way, shape, or form.
I mean, on the half full side, does that mean that herd immunity will be more rapid, like we'd get there faster? Can I go there? Can I be more? I'm looking for a little sunshine.
We could be optimistic about it. But I mean, the problem with herd immunity is we're just not sure how long immunity lasts to COVID-19. I mean, we've already seen people that have had it twice, so it's like it's kind of unclear if herd immunity is going to be a real thing or not.
Well, and that's true of most COVID, right? Like this type of virus, right? I mean, it's hard to, in general.
Yeah.
That's not a very articulate question, but I think you can ask with that. Yeah.
Well, yeah. I mean, it's why you can get like 2 colds in a row, right? In a couple of weeks, is because the viruses mutate quite a bit. There's a lot of heterogeneity in them.
That's an A+ word right there that you use.
Oh, thanks. Costs a lot of money to learn that word.
There you go. Like lots of doctor school. Okay. So what does it mean to quarantine? This is a big one that comes up and then we'll talk, like, what does that mean exactly?
Yeah, I think it's important to sort of know that there probably is no perfect definition of these things. Like it's all kind of gray area based on what you can do. I mean, like a real quarantine, like, when you're dealing with Ebola, right? Like they get put in a Ziploc room in an airlock. Like, so that's quarantine in that case. In terms of COVID, because of what we know about the way it causes infections and the way it acts as a contagion, really it means staying completely socially distanced from people. So that's, 6 feet with a mask, ideally, not sharing anything where you have secretions on in terms of, even eating with the same utensils, drinking after somebody else, those sort of things. But I think practically you can quarantine in the same house as someone else, as long as you sort of use your own restroom and wear a mask and try to stay 6 feet away. It's practical to do that.
And is there how long? 14 days is what we've heard is like around the time that you should quarantine if you've been exposed. Mm-hmm.
Yeah. So it's at least 10 days from when you first showed symptoms, or a full 14 days from a possible exposure.
Okay. Got it.
Yeah.
So as you have heard, the film industry is, as we go back to work, is employing a couple of different strategies to try to keep different departments safe. One is this idea of working in pods. So departments will work in little groups, if you will. And then there's this other idea of zoning. So, camera, like the hot set, if you will, where people are, the actors are and the director, that's zone A, and zone B is a little bit further out, and things like that. If someone were to get sick, say, in a pod or in a zone, how do you determine who should be quarantined? Because in any particular, in a pod, you could have 5 people. In a zone, you could have 10 people. Like, how do you determine who gets quarantined from your perspective?
Yeah, I mean, the current sort of CDC answer would be anybody that was within 6 feet of the infected person within the last 2 days for greater than 15 minutes.
Well, that's good. So
yeah,
within 6 feet
for
the past 2 days.
Yep.
Was the last
for greater than 15 minutes.
Okay.
Yep. So that's the current thought. It might change next week, but
right.
Yeah.
Welcome to the COVID. You think you know it. We might have to have you back. So, and then how long do you stay away from work in quarantine then? We heard 10 days minimum, 14 days is what I just heard. And then do you recommend to employer, or should employers request a letter from someone like you saying it's safe to go back to work from those people who are quarantining? Should they go see their physicians, or what do you recommend there?
I think probably the best thing is just for everybody to follow the local policy of whatever organization they're a part of, because I don't know that physicians are any more qualified than a guideline to say that people can or cannot go back. So I would say that it's kind of like, because they can go to a doctor, right, and tell them like, yeah, I've been quarantined for 2 weeks. Sure, I'll sign a piece of paper for you. But it doesn't necessarily certify that they've actually done the right thing. So I think the person's sort of vouching for their own fidelity either way. So I think just going by kind of an honor system is probably as practical as getting a doctor to sign a piece of paper.
Okay, that's great. This next topic is very popular. Masks. There's lots and lots of information. Duke just came out with that study, what is the best mask to wear to ensure protection?
So to protect yourself, in N95 is the best mask to wear, because it filters more particles by far than a regular surgical mask or a cloth mask. But the point in masking as a population is to protect each other. So, if I go in and see a patient that I know has COVID-19, and they are masked and I am wearing a surgical mask, then that is not considered an exposure, even if I'm not in an N95. Now, if I'm in an environment where there's a lot of aerosol particles being created, like for example, if they're on a ventilator or something like that, then I should be wearing an N95. But just for casual contact, if both people are masked, that's safe. That's an appropriate amount of protection.
So let me take it one step further, because, on a film set, you'll have a hair and makeup person being very close to talent, right? And in their face. In that case, is it an N95 mask, would you think? Because you're in close proximity, would that be the best route to go?
I think so, yeah. I mean, if you're that close where you can smell somebody's breath, you should, it's reasonable.
Can you smell my breath?
Yeah.
Yeah.
I think an N95 probably makes a lot of sense. And the other thing, just in the last couple of weeks, that has become protocol, at least at the Swedish system and Providence system, is wearing face shields when you're in that closer proximity.
And what is the difference between an N95 mask and a face shield?
So a face shield won't protect you from aerosolized particles, but it will prevent you from getting things in your eye. And so there's been at least a fair amount of concern that there's some virus absorption if you're close enough to somebody through your eye, that they want eyes covered now.
Mm-hmm. And another follow-up, we actually ran into this when the safety protocols came out. What is the difference between a cloth mask and a surgical mask? And is there one that is more protective than the other?
Yeah, I mean, the surgical masks are definitely going to filter more particles. But they probably, in terms of protecting yourself, they probably don't make a huge difference. I mean, so like if you're thinking about in terms of aerosolized particles, which is what you're, comparing when you compare masks, they're going to be about the same. Mm-hmm. If you think about walking into a room where perfume was just sprayed, you'd be able to smell it no matter what mask you're wearing, because there's these huge holes, on the bottom and on the top and everything. What you're looking for is more whether or not they protect other people adequately. And I think probably surgical masks are going to do a better job of filtering out as many particles as possible that you create. But for the most part, cloth masks are adequate if you're not in super close contact. But if you could get your hands on surgical masks, I would prefer those.
Okay, got it. Personal question, do you have a fancy mask? Like with this, anything on it, or is just with it at home? Do you have like a black mask, or is it just like something bedazzled?
I have a black mask, and I have a Looney Tunes mask too that I wear sometimes. So sometimes I wear it in with the kids. Yeah.
Okay.
A little less scary.
It is a little less scary. Those Looney Tunes, not so scary, kind of funny. Okay, so here's a confusing one for our industry right now, which is about glove use. And we seem to be getting conflicting information all over the place. So what is the best use of gloves and how do we use them?
Yeah, that's a good question. So the reason to use gloves in the setting of COVID is, so again, kind of just like masks, going back to sort of, are you protecting yourself or you're protecting someone else? In terms of protecting someone else, using gloves before you do something like, say, serve them food, and putting them on immediately before you serve them food makes sense. That's helpful. So it's just sort of like an extra layer of skin. If you want to think about, you're washing your hands and you put on gloves, that's like washing your hands twice, basically. Alternatively, in terms of protecting yourself, it's like giving yourself extra hand wash, I suppose. So what we do is we wear gloves in the patient's rooms, obviously. But then as we leave the room, we actually gel the gloves. So we put hand sanitizer on the gloves, and we do essentially like a hand wash with the gloves on, and then we take the gloves off, and then we wash our hands again. So it's just helping you eliminate all the viral particles. It's giving you a better hand wash, if you want to think of it like that, because nobody's secreting virus out of their hands. It's all hand hygiene. So you're just giving yourself an extra layer of hand hygiene by wearing the gloves.
So to clarify, when you walk out of a room, you gel them and then dispose of them, or do you continue to wear the gloves? So
we gel them and then throw them away and then gel our hands afterwards.
Okay, got it. So if you are in the grip department, for example, and you're moving equipment around and you've got gloves on, right? You should, after you move a piece of equipment, gel those gloves and dispose of them.
Yes.
Okay, that's cool. Okay. You mentioned hand washing, which is our next topic of conversation. So is the gels and the hand sanitizer just as good as hand washing?
So, taking into account human nature, gel is better than hand washing. So that's what we always use in the hospital for the most part. Reason being is because it's really hard to make sure that you actually use the appropriate amount of soap and water for 20 seconds every time, which is what you need to be doing. So given that, instead of trying to enforce something that's probably unenforceable, using gel and covering your hands and lathering up pretty good is in that regard better, because it's being done consistently and it's easy to replicate every time.
And what should people be looking for when purchasing a hand sanitizer?
I mean, mainly I would stick to like brands, you know, right. I mean, like Purell, that kind of stuff, like, as opposed to sort of, you know, homemade, you know, hey, my neighbor did this with some Everclear, whatever, like those probably work, but you should just buy it from a store.
Keep the Everclear for other things during COVID would be the.
Yeah, exactly. Exactly.
So this situation is constantly evolving, right? So we are constantly trying to keep up to date about what is safe and what is happening. What is the best and most trusted place to get information from your perspective? Like, how do we stay current?
It's tough, right? I mean, for the most part, I have some subscriptions to like medical journals that are doing updates once every other week or something. And so to me, those are usually the best. And the reason being is because they're honest, right? So I think anything that's kind of speaking in absolutes is a little bit questionable. Something that gives some sort of openness to changing. So I think the CDC is doing an okay job. If you go to their website, what I would say to avoid is politicians giving advice on it, because they tend to have their opinions mired in one certain way of doing things. And then, I think actually things like CNN and MSNBC and, your news outlets are, because their ability to be flexible and to change and to be malleable to the new science are probably pretty good. Mm-hmm. There's nothing definitive about this. I mean, we're still learning so much that, any source that's kind of concrete about it is probably outdated.
That is the best quote ever, right? It's all malleable right now. It's all moving and shaking.
Totally. Yeah.
So I'd be remiss not to ask, like, if we do have people who are interested in reading medical journals with those A+ words in there, which ones do you read?
So I subscribe to the Journal of Emergency Medicine, which is really good. And then I pull stuff from some of the infectious disease journals, but there's a multimedia site called EMRAP, EMRAP, and they have once a week updates on COVID-19, and they're great. I mean, they get infectious disease doctors, emergency medicine doctors, critical care, public health people to come and talk on the subject and kind of pull the data from all the journals and all the new articles. So it's a pretty good source.
Got it.
It's accessible, generally speaking, too. It's not too scientific or scholarly that you can just sit down and sort of watch a video and
maybe highly recommend a martini at the same time, given the things that are in there. So what is the most dangerous piece of misinformation being spread out there right now?
I think there's a general sense that we're doing a lot better than we were, which I think in some ways is true, but in a lot of ways is not correct. Like certainly any sort of laxity or any sort of fatigue in sort of following these prescribed measures is going to cause a resurgence. We are constantly, as we have for the last few months, operating on a precipice. kind of diving back and forth under this line of epidemic. And so there's a sense that we're on this like consistent trajectory because things keep opening consistently. Okay, now we're going to go back to school, and it feels like we're making progress. And in some ways we are, but in a lot of ways, it's really not a lot different than it has been. The infectivity numbers, the numbers of cases per day, all those things are still really, really high, especially even compared to, globally, the United States is, a hotbed. So.
Yes, it is. So within that same kind of framework, what do you wish more people knew about the situation, or what would be your thoughts on that?
Yeah, I think, I don't know. I think I wish there was actually probably a little bit less information out there. I wish that we could speak with more clarity and more simplicity about it, and kind of boil it down to, the things that we know, which is pretty simple. It's a virus. It spreads by respiratory contact. If you stay away from people, you won't get it. If you come into contact with large numbers of people in the United States, you probably will get it. And, kind of operate from a base of agreement, as opposed to, trying to come up with when's the vaccine going to come out, or, what medication is going to potentially provide a little bit of benefit, or who's at risk. It's like, yeah, I mean, if we kind of just start with what we know, I think we can do a lot better as a country and as a community.
Absolutely. So we have a few questions that have come in from the community. Do you have a few more minutes to answer this? Okay, great.
Yeah.
So one of the questions that came up is, can you talk a little bit about antibody tests and how accurate they are? And are there any updates on how many a person needs to be immune? It's a lot of questions, but.
Yeah, I don't know about the last part, in terms of immunity. I don't know, that information may or may not be out there. I'm not sure. They're 100% accurate, but we don't know what the results mean. So if we do the test and it says you have antibodies, you have antibodies. And if you don't have antibodies, you don't. And it's a pretty binary answer, in that regard. But does having antibodies mean that you're immune? We don't 100% know that information. So we can tell you if you've been infected. To some extent, we can get a pretty good idea if you're currently infected. But whether or not that data is actually helpful in quarantining or, infection control, that's the problem with the antibody test, is we just don't know what the results mean yet.
Is that similar to, we're hearing a lot about plasma, and I know that's a very different conversation, right? The antibodies versus plasma. Can you speak about the treatment? Is that what they're calling it? And where they're at with that? I know the FDA just said something about it. I'll let you jump in. You're the expert.
Yeah, I mean, the plasma treatment, it's utilizing antibodies, and it works. So there's two types of antibodies. There's M and G antibodies. And the G antibodies say that you've been infected and have developed an immune response. The M antibodies generally say that you are currently infected and are generating an immune response. So G is already infected, M is currently infected. So the plasma uses active infection immunoglobulin to treat the virus, which it definitely has some promise, but it's not something that could ever be widespread because plasma is not easy to come by.
Are there effective treatments that you're cautiously optimistic about?
Yeah, there's quite a number of things that I think are going to be helpful. There's been some work on steroids. There's been some work on antiviral medications. I think we'll come up with a number of things that will, temporize some of the severe effects of the virus. But whether or not those will be cost effective and scalable is going to be the question.
Okay. We have a question about airflow on film sets. So often, you are working within a contained space. And how important is airflow in enclosed spaces is the actual question.
It's a good question. I guess I wouldn't know enough to answer that question, other than to say that, it appears that areas with good airflow, such as outdoors, are way less risky. So I would definitely think that the more you can circulate air through, probably the better off you're going to be. But whether just moving air around with the fan makes a difference or not, I don't know.
Right. Another question we have is, if you get tested and are waiting for results, isn't it possible that you could get infected in that 48 hours from taking a test?
Totally. Yeah. Yes. I mean, that's one of the problems. Like, I wish a negative test, meant that you're currently negative, but it doesn't. A negative test just means that when they did the test 48 hours ago, you didn't have it. So, and that's why, the NBA is really the only environment that we've seen that's done it right. And what do? Well, they tested everybody every day for 14 days. So that's kind of the only way to 100% do it. It's impractical though, probably, for most environments.
The real thing is, are you rooting for anyone in the finals?
Oh, of course.
Who?
Yeah, the Mavericks. Yeah.
Yeah. Okay.
Yeah.
Is there something else, Dr. Frederick, that we didn't touch on that you think we should know as we go back to set and to work, or did we miss something that you think is really important to bring to the table?
I would say to kind of pull back to sort of this being like an honor system. And I think just more universally, that's kind of been the name of this whole game, right? Is, doing what you actually consider to be necessary work, etc. And so if you're going to go back to work and be around people, there needs to be a sense of collective burden with everybody, that it's for example, when I'm home for 5 days or something in a row, I don't go hang out with people that aren't in my family. I just don't, because I know that there's a chance that I've been exposed and I'm asymptomatic right now, and I need to have some sort of social responsibility. And when you're going into a collective work environment, it becomes even more so the case, because if you can stress the message that, hey, listen, if you're not cautious with this, if you're not responsible, you're going to hijack our whole production here. We're going to get 15 positive cases in 2 days because you went out to a frat party or whatever, and so everybody has to, not just when they're at work, but when they're off work, they have to really take it seriously and realize that the production, the outcome of this creative project is dependent on whether or not they're going to be faithful and honest with the way that they behave.
Yeah, the collective good, right? So
totally. Yeah, it's going to have to be a big team effort.
Well, this has been so incredibly helpful and informative, of course. And so thank you so much for spending time with us today. For those of you that are watching, we did record this, and it will be up on our website if you want to share it with others in the industry. In addition to that, our safety on set conversations are pivoting now to people who are working on sets and talking about what's working for them and what's not working and how they're implementing safety protocols. So keep going to the website, and we're not going to do those as live webinars. We're going to just post them on our site, and you'll find out about them in our newsletter. And as we all kind of walk down this road together and go back to work, as Dr. Frederick was saying, I think being aware of the collective good is so vitally important. And if you have questions, please, please, please lean into Filmworks, because we have access to so many different resources and we can help get you the answers that you need. Because the most important thing as we do this is that we do it together and we do it safely. So let us know if we can help. WashingtonFilmworks.org is our website. And again, Dr. Frederick, thank you so much for being here. And we appreciate all that you brought today.
My pleasure. We need you guys to make some good shows. So
yeah, we're on that.
Get it going. Yeah.
Okay. Thanks so much.
Thank you.